Sonography practice test. Question 1. Which of the following phantoms is used for sonographic quality assurance performance? Sensitometry wedge phantom, axis alignment phantom, tissue equivalent phantom, constancy test phantom. Sonographic quality assurance devices include use of phantoms, such as tissue equivalent, slice thickness, and Doppler phantoms. Alternative answer choices pertain to phantoms used in other imaging modalities. Quality assurance is necessary to ensure imaging in the medical setting is of diagnostic quality and to reduce downtime and repeat scans. Through routine, periodic QA testing observation of gradual equipment, changes may be detected, allowing for necessary modifications to be made for appropriate system operation. Question 2. Tissue equivalent phantoms should be designed with a speed of sound equal to 1.84 mm/s, 1540 m/s, 1960 m/s, for 0.28 mm/s. Tissue equivalent phantoms should mimic the speed of sound in soft tissue, which is expressed as an average of 1540 m/s or 1.54 mm/s. Tissue equivalent phantoms evaluate phased array transducers for demonstration of appropriate soft tissue texture and grayscale imaging. Within a tissue equivalent phantom are structures of varying echogenicity to ensure equipment detection of cystic versus solid masses within soft tissues. Question 3. Which of the following is an ergonomic device integrated into sonographic equipment for musculoskeletal safety of the sonographer? Monitor articulation, fixed control panel, wrist support brace, long transducer cable. More than 75% of sonographers cope with musculoskeletal injury pain during the span of their career. For this reason, sonographic equipment has evolved in its ergonomic design for sonographer safety. Adaptive devices integrated into sonographic equipment include cable braces, articulation of the sonographic display and control panel, including extension and swivel features, and lightweight transducers. Additional ergonomic devices, although not integrated into the sonographic machine, include support cushions, wrist braces, and adjustable ergonomic chairs, among others. Question 4. The acoustic parameter that best describes a pulsed sound wave is: period, propagation speed, frequency, duty factor. Duty factor, pulse duration, spatial pulse length, PRP, and PRF describe pulsed sound. The 7 acoustic parameters that characterize non-pulsed acoustic waves are period, propagation speed, frequency, wavelength, power, intensity, and amplitude. Question 5. Speed of sound is highest in fat, liver, bone, blood. Compared to other biologic tissues listed, bone has the highest speed of sound at 3,500 m/s. The average speed of sound in fat is 1,450 m/s, whereas the speed of sound in the liver and blood are both 1,560 m/s. The average speed of sound in soft tissue is 1,540 m/s. Metallic devices implanted in the body also demonstrate substantial speed of sound, ranging from 2,000 to 7,000 m/s. Question 6. Which of the following values for PRF exhibits the longest PRP? 3 kHz, 7 Hz, 1000 Hz, 12 kHz. Pulse repetition frequency, PRF, and pulse repetition period, PRP, have an inverse, reciprocal relationship. Therefore, the lowest value for PRF 7 Hz would have the longest PRP. Question 7. Underscore 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 resolution increases as frame rate increases. Temporal, spatial, elevational, lateral. Frame rate, or number of images, frames, per second, determines temporal resolution. Temporal resolution improves as frame rate increases and is reduced as frame rate decreases. Factors that determine frame rate include imaging depth, pulses per frame, a medium speed of sound, single versus multifocus, line density, and sector size. Essentially, Any adjustment that adds more detail or asks for more information to be displayed decreases frame rate and temporal resolution. Spatial, elevational, and lateral are also forms of sonographic imaging resolution, but temporal resolution has to do with how fast an image is. Question 8. What is the effect to the image display when the PZT crystal is damaged in a mechanical transducer? Horizontal band of dropout, vertical band of dropout, loss of entire image, inconsistent beam steering and focusing. Mechanical transducers have a single active element, PZT crystal. Therefore, when the crystal is damaged, the entire image display is lost. Question 9. With transducers, numerous PZT crystals are arranged in an arched line. Annular array, convex array, linear array, mechanical. The active elements, PZT crystals, in convex array transducers are positioned in an arched line, like a rainbow. Synonyms for convex array include curved array or curvilinear array transducers. The top of the displayed image appears as a blunted sector. Alternatively, the active elements in linear array transducers are positioned in a straight line, with the resulting image depicting a rectangular shape. The active elements in an annular array are arranged in a bullseye pattern, and the resulting image is a sector shape. Question 10. A sonographer is performing an exam utilizing an annular array transducer. There is a horizontal band of dropout in the near field of the displayed image. This most likely correlates to damage in which PZT crystal ring, innermost ring, middle ring, outermost ring. The resulting image would have a vertical band of dropout with an annular array transducer. Active elements in an annular array transducer are positioned in a bullseye fashion. When damage occurs to the innermost element, the displayed image will have a horizontal band of dropout in the near field. The middle ring correlates to mid-image display. The outermost crystal correlates to the far field in the displayed image. A vertical band of dropout would occur in damage to a linear or convex array transducer, directly under the location of the damaged active element. Question 11. A linear phased array transducer has a PZT crystal cut into 280 individual active elements. How many channels does this transducer have? 1, 140, 280, 560. This transducer has 280 channels. For each active element, there is a channel. A channel consists of the PZT crystal, system electronics, and connecting wire. Each crystal is connected to the system electronics via the wire, allowing each element to be individually excited, which produces a sound wave for transmission into the body. This allows for electronic steering and focusing in the array transducer. Question 12. 3D transducers have active elements positioned in a, n, ________________ pattern. Arched, backgammon, straight, checkerboard. A 3D transducer is essentially a 2D transducer with numerous PZT crystals positioned in a checkerboard pattern. There are typically thousands of individual active elements in a 3D transducer. The acoustic beam is electronically steered and focused, while rendering produces the final image from captured data. Question 13. Which of the following occurs when depth is increased? Time of flight decreases, frame rate decreases, T-frame shortens, temporal resolution increases. As depth is increased, the frame rate decreases. As a result, temporal resolution also decreases. However, more information is displayed on the image at a greater depth in the body. For each 1 centimeter deeper, the go return time of flight, increases by 13 microseconds according to the 13 microsecond rule. T-frame refers to the number of imaging pulses multiplied by the pulse repetition period, therefore deeper imaging results in a longer T-frame. Question 14. The sonographer has adjusted system settings, increasing output power. Which of the following occurs? Overall gain increases. The displayed image darkens. Voltage decreases. Penetration decreases. As output, or transmit, power is increased, the overall gain and brightness of the displayed image increases. Additionally, active elements undergo a higher voltage. This increase in energy also results in greater image penetration. The sonographer should be mindful of the ALARA concept in understanding that increasing output power applies more energy to the patient's body. Question 15. Which display mode includes data pertaining to a moving reflector over a period of time? A mode, B mode, M mode, Z mode. M mode is frequently used in cardiac imaging. One common use of M mode is to obtain a fetal heart rate. This display mode demonstrates variance in position of anatomic structures over a period of time displayed on the x-axis. Depth is displayed on M mode's y-axis. Question 16. A sonographer adjusts the TGC settings on a system console as shown in the following image. As a result, the displayed near field is brighter, unchanged, darker, anechoic. Sliding time gain compensation, TGC, knobs towards the right increases brightness on the displayed image. The upper knobs correlate to the displayed image's near field, whereas the lower knobs correlate to the displayed image's far field at increasing depths. Knobs towards the middle of the TGC curve correlate to the middle of the displayed image. The console's TGC function is useful to compensate for image attenuation, producing a uniformly bright image from top to bottom. Question 17. Amplifying image contrast directly at structure boundaries best describes frequency compounding, fill-in interpolation, edge enhancement, spatial compounding. Edge enhancement provides emphasis to the edge of anatomic structure boundaries by modifying contrast and highlighting. This defines the edge of structures in creating a sharp appearance. Edge enhancement may be useful for depiction of near-isoechoic adjacent structures. Frequency and spatial compounding are system technologies that aid to reduce sonographic artifacts, such as shadowing, speckle, and noise. Fill-in interpolation is a pre-processing technology that simulates data between scan lines, increasing the displayed image's spatial resolution. Question 18. Spatial compounding uses electronic steering technology to increase frame rate, decrease speckle artifact, enhance shadowing artifact, improve temporal resolution. Spatial compounding is a technology that produces an image using numerous overlapped frames. This overlapping of frames is referred to as compounding. Each of these frames is obtained from varying angles, then compounded to display a single image. Benefits of spatial compounding are decreased in artifacts such as shadowing and speckle. However, as a result, temporal resolution is decreased. Question 19. A technology that involves lengthened sound pulses with a wide frequency range to improve image quality and penetration refers to coded excitation, frequency compounding, interpolation, harmonic imaging. Coded excitation lengthens sound pulses in the pulsar, spreading peak energy intensity over with a wide frequency range. Simultaneously, lengthened pulse reflections are shortened by system electronics using a mathematical technique. This aids in improving axial resolution while improving image penetration, signal-to-noise ratio, spatial, and contrast resolutions. Frequency compounding is a system technology that aids in reduced sonographic artifacts, such as shadowing, speckle, and noise. Fill-in interpolation is a pre-processing technology that simulates data between scan lines, increasing the displayed image's spatial resolution. Harmonic imaging refers to a technology in which the image is created via reflected frequencies twice that of the transmitted, fundamental, frequency. There are various forms of harmonic imaging, such as pulse inversion, contrast, tissue, and power modulation harmonic imaging. Question 20. Harmonics created during reflection and require use of microbubbles best describes pulse inversion harmonics, tissue harmonics, fundamental harmonics, contrast harmonics. Contrast harmonics are produced during the conversion of energy from fundamental to the harmonic frequency as microbubbles interact with the acoustic wave. When microbubbles and the acoustic wave interact, microbubbles react in a nonlinear fashion, expanding and contracting. Contrast harmonics are produced during reflection. The mechanical index, μ, determines harmonic strength and microbubble reaction. Tissue harmonics include harmonics as they relate to energy transfer from the fundamental to harmonic frequency within soft tissues. This results from a nonlinear behavior of acoustic energy compressions and rarefactions while traversing through soft tissue, decreasing the likelihood of artifacts to appear within structures. Pulse inversion harmonics is another technology in which negative and positive acoustic pulses are sent down each individual scan line. These pulses undergo destructive interference, canceling each other out while the nonlinear, harmonic reflections remain. Fundamental harmonics is not a real term. Question 21. Which color Doppler application specifically removes color from slow-moving flow? Wall filter. Increasing PRF, color gain. Decreasing PRF. Wall filter specifically removes color from areas of slow-moving flow while utilizing the color Doppler application. High velocities are not affected by wall filter adjustments, therefore wall filter is a useful feature for decreasing ghosting artifact. Question 22. Pulsed wave Doppler is subject to aliasing, range ambiguity, requirement of 2 or more active elements, high Q factor. PW Doppler transducers are subject to aliasing. Aliasing occurs with high velocity flow, when velocity exceeds the Nyquist limit at the top of the spectral Doppler display. To reduce aliasing, the sonographer may utilize a CW Doppler transducer or with a PW Doppler transducer move the baseline, increase scale, utilize an alternative sonographic window for a shallower sample volume, or decrease transducer frequency. Range ambiguity is the inability to visualize a sonographic image, i.e. with CW Doppler transducers, to determine an exact selection point for Doppler sampling within the anatomical region of interest, such as the center of a vessel. The opposite of range ambiguity, which is true with PW Doppler transducers, is referred to as freedom from range ambiguity artifact, range resolution, or range specificity, all of which are synonyms. A PW Doppler transducer requires a minimum of 1 PZT crystal, or active element, which sends out pulses of acoustic energy, alternating between transmission and listening time for the reflected pulse. PW Doppler transducers have a low Q factor, versus CW Doppler transducers which exhibit a high Q factor. Q-, or quality factor, is unitless, and refers to a transducer's bandwidth. To determine Q factor, the transducer's primary frequency is divided by the bandwidth, therefore dampened pulses exhibit a low Q factor whereas long pulses with ringing exhibit a high Q factor. CW Doppler transducers create long pulses, as short pulses are not necessary with no image being created. This means a higher Q factor and increased sampling sensitivity. Question 23. An artifact that occurs with excess color gain is referred to as color funfetti, crosstalk, color confetti, color bleed. Color confetti refers to excess color gain. With color confetti, speckles of color appear throughout the entire color Doppler box rather than solely in the region of interest, vessel. Color funfetti and color bleed are not actual terms. Crosstalk is an artifact that refers to spectral Doppler imaging versus color Doppler imaging and is a mirrored image display of the spectral Doppler waveform. Question 24. The separation of low Doppler frequency from the carrier frequency of the transducer is termed Doppler shift, frequency reflection, demodulation, phase quadrature. Demodulation is the removal of the low Doppler frequency from the carrier frequency of the transducer. To better understand demodulation, it is helpful to understand Doppler shift, or Doppler frequency. The Doppler shift is expressed in a unit of Hertz and is equivalent to the reflected frequency minus the transmitted frequency. The Doppler shift is either a negative or positive value. With a positive Doppler shift, the reflected frequency is greater than the transmitted frequency, typically encountered when the direction of blood flow is moving towards the transducer. The opposite is true with a negative Doppler shift. Frequency reflection is not a real term, a made-up distractor. Quadrature detection, also referred to as phase quadrature, is a Doppler signal processing technology. Question 25. Which of the following is not a spectral Doppler artifact? Crosstalk, aliasing, clutter, reverberation. Reverberation is a grayscale imaging artifact. This artifact has a classic Venetian blind or ladder appearance, resulting from too many reflections. Reverberation artifact is displayed as numerous echoes that are equally spaced parallel to the main axis of the sound beam. Crosstalk, clutter, and aliasing are all artifacts that can occur with spectral Doppler display. Question 26. On a color Doppler map, the color depicted above the black baseline indicates flow moving towards the transducer, a negative Doppler shift, flow moving away from the transducer, high velocity flow. A color Doppler map is used to display both direction and velocity of blood flow during implementation of color Doppler. Above the black baseline, positive Doppler shifts or flow towards the transducer are demonstrated. Therefore, if color displayed on the color Doppler map above baseline is red, red superimposed color flow within a vessel would indicate blood flowing towards the transducer. As velocity increases, color of flow changes to a variation of hues including yellows, greens, etc. Question 27. When a longer ensemble length is utilized, there is decreased sensitivity to low flow. Temporal resolution improves. There is improved accuracy with velocity measurements. Frame rate increases. Multiple pulses utilized with color Doppler in reference to blood velocity is referred to as a Doppler ensemble or packet. Increased packet size or ensemble length provides greater accuracy with measurement of blood velocity. However, as with most applications that require additional processing of data, frame rate and temporal resolution decrease. Question 28. Measured Doppler frequencies indicate the ________ of blood flow, speed, velocity, magnitude, direction. Doppler frequencies demonstrate the velocity of blood flow, whereas speed solely reports distance over a period of time. Velocity describes both the speed and direction the blood is flowing. Question 29. Which of the following best describes a continuous wave transducer? Creates an anatomic image. Contains one active element. Range resolution is an advantage. Measures high velocities with great accuracy. One of the most beneficial advantages in using a CW Doppler transducer is the ability to document elevated velocities with a great level of accuracy. CW Doppler transducers contain two active elements that constantly receive and transmit acoustic energy. As a result, no anatomic image is created and therefore an exact sampling location within the anatomic structure being evaluated is not possible, referred to as range ambiguity. CW Doppler transducers are often utilized for vascular studies. Question 30. A Reynolds number of less than _______ is indicative of laminar flow. 1200, 1500, 2000, 2500. A Reynolds number of less than 1500 is indicative of laminar flow. Greater than 2000, however, is indicative of turbulent flow. Reynolds number was designed to predict streamlined laminar versus disrupted turbulent flow within a vessel. Turbulent flow is commonly visualized post-stenosis.